Good evening, and thank you for joining us. We begin with breaking news tonight because the death toll from the pandemic continues to rise, even as there are signs that the spread of the virus is slowing. It is an especially cruel contradiction for those who have lost loved ones. In the epicenter of the crisis, New York State, 779 people have died in just the past 24 hours. That is yet another record. And the state now has more confirmed cases than every country outside of the U.S. And as we come on the air, coronavirus cases nationwide have passed 400,000, with more than 14,000 deaths. And yet there is that evidence that the curve is flattening. The number of patients being admitted to hospitals in some areas is slowing, and some models show the crisis may reach its peak sooner than thought. Tonight, the CDC is working on new guidelines to get some Americans back to work under certain conditions. And although the governor of New York warned today it is still too early to let our guard down. There's a lot of news to get to tonight, and our team is covering every angle. Mola Lenghi leads off our coverage in New York City. Mola?
Well, Nora, hospitals like Elmhurst here, which has been at the center of this crisis, are still anticipating that peak in deaths. Health officials expect that to happen. They're predicting by this weekend nationwide. But Nora, tonight, the hope that we are seeing in some new numbers, that is mixed with a lot of pain.
Another day, another record. Deaths hitting a new high in New York. But a hopeful sign that the curve is flattening as COVID hospitalizations have leveled off 3 straight days.
That curve is purely a function of what we do day in and day out. If we stop what we are doing, you will see that curve change.
On the front lines, the fight to save patients continues at great cost. New York EMS Lieutenant Antonio Quiones just finished working 80 hours in 5 days, every night sleeping at the station, away from his wife and 2 kids.
It's the first time I had to do that, to be away from them for so long. My family is my life, so it is extremely difficult to be away from them and then to not know if I'm bringing them, exposing them to something.
Pam Tavarone contracted the virus on the job as an ICU nurse in New Jersey. She says the work is as emotional as it is physical.
We don't have time to drink. We don't want to take our masks off to drink because we're afraid to.
With hospital visitations limited, New York cardiologist Evelina Graver is also acting as an emotional lifeline for families. Here, helping her 84-year-old patient FaceTime his daughter for the first time since he was intubated.
To tell them the fact that we no longer can provide the critical care that your family member may need. I'm not God. I'm far from God. I'm just very limited in resources.
And the longer-term projected U.S. death toll is now 60,000, down from 93,000 just a week ago, due in part to the success of social distancing. Today, New York's governor directed flags to be flown at half-staff in honor of those who died, including Wendy Hu, a real estate agent from Brooklyn, described by friends as brilliant, witty, and caring. Among the victims in New Orleans were 4 members of the Franklin family, 86-year-old Antoinette and her 3 sons, Herman, Timothy, Anthony, died within days of each other.
Well, New Orleans is just one of the concerning hotspots nationwide. This evening, we're also hearing about one of the largest cluster of cases in the country at one of the largest prisons in the country, Cook County Jail in Chicago, where more than 300 inmates and staff have tested positive. Nora?
All right, Mola, thank you.